Peptic ulcers are common, affecting as many as 10% of Americans at some point in their lives. The good news is, successful treatment of peptic ulcers is possible. We spoke with Dr. Frank Lee at Redlands Community Hospital in Redlands, who gives us more information on this disease.
Peptic ulcer occurs when there is a break in the surface lining of the stomach or the duodenum that actually penetrates to the deeper layer. And if that ulcer occurs, then we call that peptic ulcer disease. The symptoms of the patient are mostly abdominal pain. And then they usually describe it as a abdominal pain occur about 2 to 3 hours after they eat something. And one common feature is also that when the patient usually describes when the pain occurs, when they eat something, it actually calms it down. And so those are the main presentation of peptic ulcer disease.
And just how does a peptic ulcer occur?
Two most common noxious agents to our stomach that can cause peptic ulcer disease. One is Helicobacter pylori infection. Helicobacter pylori is a bacteria that mostly infects the stomach. It occurs more in the underdeveloped countries. However, even in the United States, people approaching 60 have about 60% diagnosis of Helicobacter pylori infection. The other main noxious agent that can cause peptic ulcer disease is a class of medication called non-steroidal anti-inflammatory drugs, which include aspirin. And those medications are very commonly ingested in the United States. Those medications can cause a direct caustic injury to the stomach. It also causes a decreased production of a chemical called prostaglandin. And prostaglandin is heavily involved in the defense mechanism in the stomach. So a decreased prostaglandin leads to higher risk of peptic ulcer. The common noxious stimuli that can cause peptic ulcer disease are tobacco and alcohol.
How do you diagnose a peptic ulcer?
The main diagnosis tools for peptic ulcer disease involve an upper GI radiography or X-ray, but the preferred method is a direct examination with the endoscope called EGD or esophageal gastroduodenoscopy. The advantages of doing a direct examination with the endoscope is that we can directly see the ulcer. If the ulcer appears atypical, because sometimes a gastric cancer can mimic a gastric ulcer, if that look like could be the case, then biopsy can be obtained at the same time. And also, EGD also allow direct biopsy of the stomach to evaluate for Helicobacter pylori infection. And the third advantage would be if the ulcer looks like it can show some risk of bleeding in the future, then cauterization can be done at the same time to prevent future bleeding with the ulcer.
What are the treatment options for peptic ulcers?
Treatment of peptic ulcer disease mostly involve acid suppression. And currently the most potent medication that we have in the United States is a class of medication called proton pump inhibitor. And this proton pump inhibitor works on a particular pump in the stomach cells that generate stomach acid. So by inactivating the pump, then it decreases the production of stomach acid. And this class of medication is very effective. More than 80% of ulcer will heal with 1 month of treatment of proton pump inhibitor. There's no data suggesting that psychological stress can lead to peptic ulcer disease or can delay the healing of peptic ulcer disease. We just don't have that data at this point.